Hi, everyone. Welcome to our September installment of Webinar Wednesdays with SMP. We appreciate you all joining us this morning to learn more about home health and hospice red flags for fraud. My name is Sunny Lawless, and I'm the volunteer coordinator for our SMP programs. I'm going to be your host this morning. Our presenters today are Shay Lewis and Jeanette Ringo. Shay is one of our community outreach specialists in Georgia, and Jeanette is one of our community outreach specialists in Mississippi. During our presentation, you can type any questions that you have into the chat, but we'll hold those until the end of the presentation when we open it up for Q&A. We will also have a prize drawing later in the presentation for those who were registered to attend by 10:15 a.m. and you must be present to win. Now, before we get started, I do have to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. So if you've never been to or heard an SMP presentation before, I do want to share some information about our program. Senior Medicare Patrols, or SMPs, were grant-funded projects, like I said, the Department of Health and Human Services and the Administration for Community Living. Every state has its own SMP program. In Georgia, Louisiana, Mississippi, and Vermont, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Now, before I turn things over to Shay and Jeanette, we do have a quick polling question for you. Our question today is, do you know the differences between home health and hospice care? So that's going to be a yes or no. I've launched the poll. If you'll just take a second to collect yes or no, or select yes or no. Do you know the differences between the two, between home health and hospice care? And I'll give everyone just a few seconds to get those votes in. Okay, it looks like we're almost there. Just a few more left. I'll give it about 5 more seconds. All right, let's see. I'm going to share those results for you. So it looks like 100% of you know the differences between the two. So now I'm going to turn things over to Shay, who's going to talk about the differences between the two and how fraud might occur with home health and hospice fraud. Shay?
Good morning. So we're going to talk about the differences between home health and hospice. There are several differences between home health and hospice care. In addition, there are some similarities that make it difficult for people to tell the difference between the two. Today, we're going to take a look into those differences to get a better understanding of these two different types of care services and how we can actually avoid becoming a victim of Medicare fraud. Next. First, we're going to discuss home health. Next. Home health is defined as a wide range of health care services that can be given in your home for an illness or an injury. Next. Medicare covers most home health services considered reasonable and necessary for the treatment of an illness or an injury, usually after a hospital stay. The home health agency must be deemed Medicare certified. Home health agencies work with your doctor to evaluate your healthcare needs and tell you what home care services you will need. To be eligible for these particular services, your doctor must certify that you are homebound and require at least one of the covered services. Next. Home health is for individuals who are expected to recover from either the illness or injury for which they are being treated. Some of the services that are covered by Medicare are skilled nursing care on a part-time or intermediate basis. This particular care is covered and performed by a registered nurse or a licensed practical nurse. Physical therapy, speech therapy, and occupational therapy. Home health aid services on a part-time basis to assist you with things such as bathing, using the bathroom, or dressing. Medicare will not, again, repeat, Medicare will not pay for anyone to assist you with household chores such as vacuuming or washing your clothes. Next. And some of those continued coverage services also include durable medical equipment such as walkers, wheelchairs, or bedside commodes, and certain medical supplies, just like wound care dressings that are ordered as part of your care. Next. Now we're going to be talking about hospice care and the coverage. Next. Hospice is a special way of caring for people who are terminally ill. Hospice care involves a team-oriented approach that addresses the medical, physical, social, emotional, and spiritual needs of the patient. Hospice also provides support to the patient's family or caregiver. To qualify for hospice care, a hospice doctor or your personal doctor must certify that you are terminally ill, meaning you are not expected to live for more than 6 months, as well as homebound. When you agree to hospice care, you are agreeing to comfort care instead of care to cure your illness. You must also sign a statement choosing hospice care instead of other Medicare covered treatments for your terminal illness and related conditions. Next. Some of the coverage for hospice care may include the particular following: all items and services needed for pain relief and symptom management, medical, nursing, and social services, medications for pain management, durable medical equipment for pain relief and symptom management. This may be things such as wheelchairs, electric hospital beds, bedside commodes, etc. Next. With hospice care, you are acknowledging that you are not going to get better, and therefore the focus is on giving you the best quality of life possible given your condition. In this particular case, you may have an aide come in to assist you with your bathing, going to the bathroom, and any other personal hygiene care you may need. Hospice care also allows you to have homemaker services. This is someone who will assist you with things such as light housework, changing your bed, washing your clothes or dishes. Now, this is one of the differences between hospice care and also home health. Next. Now that you know the good difference between home health and hospice care and also coverage, we're going to talk about the different types of fraud that could occur with these services. Next. The most common home health fraud scheme is when Medicare is billed for services such as physical, occupational, or speech therapy that were never actually provided. The beneficiary is asked to sign blank forms during a home visit. This allows the agency to then bill Medicare for a variety of services that were never provided. You also have particular physicians that may also fraudulently certify that a beneficiary is homebound when they're not. Sometimes the beneficiary is offered cash or other incentives to sign forms and allow the physician to charge Medicare for services that they did not perform. Another example of home health fraud is when Medicare is billed for skilled nursing care, but such care is not provided at all. Instead, the provider sends money to the beneficiary's home to help with housekeeping and errands, but bills Medicare for skilled nursing services. Next. Some examples of hospice fraud, and this normally occurs when Medicare is falsely billed for services that are defined as hospice care. And some examples also include a provider enrolling a patient in hospice care without the knowledge or permission of the patient or the family, A provider falsely certifying that the beneficiary is terminally ill. Again, this is with a life expectancy of 6 months or less if the disease runs its normal course. A provider billing for a higher level of care than needed or provided, or billing for services that were not provided. A provider keeping a beneficiary enrolled in hospice care for long periods of time without any medical justification, and also providing inadequate or less care on weekends and disregarding a beneficiary's care of plan. Next. To avoid becoming a victim of home health and hospice fraud, keep these particular tips in mind. Never sign a blank form from your home health or hospice provider. Avoid offers for gifts or cash in exchange for your Medicare number. Watch your MSN or your EOBs, those are your Medicare summary notices or your explanation of benefits, to make sure Medicare has not been billed for home health or hospice services that were not provided. And only agree to home health or hospice services if your doctor has certified you to receive those particular services. Next. Now I will turn things over to Jeanette, and she will share the SMP 3 keys to success in preventing Medicare fraud.
Good morning. The first key is prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. Share your Medicare number only when necessary, such as at a doctor's office or pharmacy. Only carry your Medicare card when you know you will need to use it. Remember, Medicare will not call you to ask for your Medicare number for any reason. Keep all records of all medical visits and procedures that take place and medical equipment ordered. Next slide, please. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare summary notice, MSNs, or explanation of benefits, called EOBs. Your Medicare summary notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive healthcare services. Compare your statements to your personal records and look for the following items: medical appointments you did not attend or were double billed for, medical equipment such as braces, catheters, or diabetic supplies you did not order or receive. Next slide, please. The third and final key is report. If you suspect you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call immediately to SMP. If you have questions about your Medicare statements, call your healthcare provider or plan. If you aren't comfortable calling your provider or you aren't satisfied with their response, call SMP at our 877 hotline number shown on your screen. Next slide, please. You might be wondering, how can you help and become involved? The Senior Medicare Patrol Program is always looking for individuals to join our fight against Medicare fraud. Our volunteers receive training on the basics of Medicare and home health care errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for the SMP program is extremely flexible and is done on an as-needed basis. They determine how often they would like to participate. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number, 877-272-8720. We can send a volunteer information pack and answer any questions you might have about the process. Next slide, please. Want to stay up to date on the latest scams impacting older adults in your community? Just scan the QR code using the camera on your cell phone to be guided to our social media platforms, including Facebook in Georgia, Louisiana, Mississippi, and Spanish Facebook pages, YouTube, and our podcast, Sip and Learn with SMP on Spotify and Apple Podcasts. Our state-specific SMP Facebook pages especially are a great resource for older adults and their care partners to find out about hot scams happening as soon as we learn about them from reports called into us from our community partners. Next slide, please. As mentioned in the previous slides, we have a toll-free number at 877-272-8720. You can call to report potential healthcare fraud or to ask questions about potential fraud, and even to request we attend your event or speak to your group on our fraud prevention message. The SMP cannot be successful in fighting Medicare fraud without reports from people like yourself and invites allowing us to reach older and disabled adults in your community. Additionally, you can visit our website, www.stopmedicarefraud.org, for more information about the SMP program in your state. Our website can be viewed in multiple languages by adjusting the language tab at the top right part of the screen. Next slide, please.
All right, thank you, Jeanette, for that, and Shay for that information. So coming up next month for our Webinar Wednesdays series, we're going to cover open enrollment and fraud. That webinar is scheduled for Wednesday, October 30th at 10:30 Central Time. So be on the lookout for an invitation to sign up for our October installment of Webinar Wednesdays. All right, now it's time for our prize drawing. Everyone who was registered to attend today's webinar prior to 10:15 a.m., your name has been entered into our drawing, and you have to be present to win. So give me just one moment and I will spin our wheel and see who we have. Let's see. It looks like Miss Deborah, and I don't see her name here. So we'll just try again. We have Miss Sandra H, and Miss Sandra is not with us this morning. We'll try this one or two more times and hopefully get a name. All right, Melissa K. It looks like Melissa is on the call. So Melissa, I will reach out to you later today to find out which gift card you would like to receive and to get that email address from you. Right, so let's get back over to our slides. There we go. All right, so before we wrap up today's presentation, I want to open it up to question and answer. So if you have a question for us regarding the information that we presented today, you can just raise your hand. You should have a little go-to control panel. Mine usually appears on the right-hand side, but there's the little hand icon. And if you click on the hand, it will raise it for you. And we'll unmute your line so you can ask your question. Okay, well, well, I'm not seeing any hands raised for questions. So what we'll do now is we're going to wrap things up. It'll conclude our presentation on home health and hospice fraud today. You will receive an email from us with a short survey. So we would really appreciate it if you would click the link to the survey and just let the Administration for Community Living know how we did today. We also appreciate you attending today. We hope to see you again soon and have a great day. Thank you, ladies, for presenting today.
Problem. Have a good one.
Thank you.